see here. And I'm going to move that up. Bear with me as I figure this out, because sometimes there we go. Now I can see most of the screen, which is a good thing. Can everyone see a benefits presentation? If you can just do yes. All right,
Yes.
Nice. Okay, I can't see all of you anymore. So if you have questions as we go through this, please do feel free to shout them out and we will stop and talk about your questions. So we're going to talk about benefits today. That's why you're here for this hour. And we really want to make sure that you are in good health. This work that we do is very hard and difficult. And we want to be an organization where our folks who work here have the best possible benefits at the lowest possible cost so that they can take care of themselves and their families. So each year we look for the best plans and pick what we can to keep that cost down. Right now, through October 31st, which is the end of our plan year, the agency pays 100% of the medical, dental, and vision premium cost for each of you as individual employees. What does that mean? It means that when you sign up for a medical plan, there is a monthly charge associated with it, as well as anything that you're going to pay to the doctor for any services or visits that you have. So through October 31st, at the least, the agency is paying 100% of that monthly cost for you. You don't have to pay anything out of your paycheck for that. And in addition, we pay the $40 copay for primary care physicians and most specialists through something called the difference card that we'll talk about. So this is a huge, huge benefit because not only are you paying nothing for that monthly cost, you're not paying for that $40 copay when you go see your PCP, your primary care physician, your doctor, or most specialists. There are some specialists, I call them the special specialists, where the copay is a little bit more, and we'll pay $40 of that. But for most of your visits, you're not going to pay anything out of pocket because the copay is covered. That's kind of unheard of. We have tried really hard to keep healthcare not only affordable, but free for the staff here. And we're going to do what we can to keep that going. We have a lot of benefits available to get through today. We have medical, dental, vision. Then we have agency paid life and this horrible thing called accidental death and dismemberment. And we'll talk about what that means. Then there's employee paid voluntary insurance through Guardian. We have a resource advisor employee assistance plan, flexible spending accounts, and a 403B retirement plan. So we'll go through all of these in some detail. Who can enroll in the benefits? Well, full-time eligible employees. And for us, what that means is people who are working 30 or more hours each week. That is how our plans are written to be full-time. So some people may panic, oh, I only work 38 hours this week. Nope, don't worry about it. Some people are part-time at 32 hours a week, so maybe they work 4 days a week, but in the eyes of our benefits plan, they're still full-time employees because they're working over 30 hours a week. So full-time employees, then your legal spouse and domestic partners, and then any dependent children, stepchildren, children of your spouse or domestic partner up until the age of 26. All of those people can be on the medical plan here and take advantage of the other health benefits. When can you enroll? Well, new hires, that's what you all are, following your wait period. And so for us, if you looked at the overview that you got with your welcome email, we have benefits available the first of the month following 30 days of employment. So for everyone so far who started in August, that would be people who started on August 3rd, 10th, and 17th, and 24th, you will all be eligible for benefits effective October 1st. I kind of think of it as, okay, we go August to September, that would be 30 days, and then the first of the month following is October 1st. It's very important that you all remember October 1st, because we're going to talk at the end about how you sign up for benefits. You can also enroll during open enrollment, and that will actually be coming up in October for us. So our plan year runs 11/1, so November 1st through October 31st. It's not a calendar year, it's not a fiscal year, but it's a plan year. It was set before I came here. Don't blame me. So you have the unique experience of all August hires do. My last place of employment was this way too. Hired in August, you have 1 month of the benefits in October at whatever the plan is when you start. And then November 1st, we may start another plan. We may have different benefits. I'm not saying we will, but it's possible because we go through a renewal process each year. And that's the process where we try to get the best benefits at the very lowest cost. And then you can also enroll within 30 days if you have a qualifying or a life event. What that means is like a family change. So if you have a baby, if you get divorced, if your spouse loses their health care through their work. And then your elections remain in force, or they remain, you cannot change them until the next open enrollment period unless you have a qualifying event. So whatever you choose now for you is only going to be in effect or in force for that 1 month of October, because then we'll be going through open enrollment in October for the benefits year starting November 1. It kind of sounds confusing. It's not that confusing. Anybody have questions about when they're eligible for benefits? All of you, October 1st.
I'm just confused by what happens in November if the plan's from December 1st to October 31st.
Yeah. Yeah.
Okay.
Yeah, it's confusing for you all because you're in this weird place that you'll only have this 1 month of our current benefits. So
okay. Is there coverage for November?
Yeah. Oh, yes. We will.
Oh, okay.
Yeah. Absolutely. Please do not think that we will not have coverage in November. Actually, I have a meeting at 1 o'clock today. We're looking at all of our options for next year.
Okay.
So yes, we will still give you. We'll still give you insurance in November. I just can't guarantee it will be exactly like this insurance. It will be very similar, but it may or may not be exactly like this, because each year the providers, the carriers come back with different rates, different plans, that sort of thing. But we will have medical, dental, and vision. We'll have additional insurances. We'll have the EAP. We'll have the retirement plan. We'll have the flexible spending accounts, the life insurances. All of that will still be there. Okay, great. So another thing that might be confusing, and that's why we put it at the beginning, is how our medical insurance works with this thing called the difference card. So we're in a kind of a unique situation that we buy a medical plan for you all. We buy a plan that is not that great, but we use what's called a health reimbursement account. You don't need to remember that, through the difference card to pay for things that normally you would be paying for on that less than great plan. That way it's less money out of your pocket. We're able to pay that lower monthly cost, and hopefully there's no disruption to you or anything that you have going on. So Anthem is the medical carrier that provides the plan and gives you the services. The difference card is a company and a physical MasterCard that works in conjunction with that plan. You're automatically enrolled when you enroll in the Anthem medical plan, and the difference card itself is a MasterCard for you to swipe. We'll go through how you use the difference card in just a minute, but I wanted to show you kind of how the difference card works with our medical plan. So this first column here, the base Elements Choice HMO 3500, you can see that there's a deductible. And a deductible means that you would pay that out of pocket before any other of the plan benefits kicked in. However, with the difference card, you'll see you pay 0 of that deductible. The agency pays the deductible through the health reimbursement account. So the column that you're interested in and finding out how much this stuff costs is this one, because you are going to pay these amounts. So 0 of the deductible. You have no out-of-pocket max. You have 0 cost for office visit because we pay for that $40 copay. There's never any charge for routine preventative care anyway. Any x-rays, outpatient diagnostic lab, 0. Advanced imaging, you can see 0 cost to you when you file a reimbursement claim. Any CAT scans, PET scans, MRIs, that kind of thing, 0 after you get reimbursement. Outpatient surgery, 0 after you get reimbursement. inpatient hospital stay, if you ever have to go to the hospital, the most that you're going to pay out of pocket is $250. Zero for an urgent care facility because it'll be $40 when you swipe your MasterCard. Chiropractic, $0. You'll swipe it for $40. So all of that, all of these medical parts, and you'll get this presentation after this, after our time, all of these medical parts are paid in some way through the difference card. And this column on the right tells you whether you swipe the MasterCard or you have to file for reimbursement. We'll talk about that in a minute. And then with the plan, the difference card does not pay for prescriptions, but your prescriptions are $10, $30, or 20% up to $200. You pay that out of pocket according to the formulary that we have. So it can be a weird concept. Has anyone ever had this situation at a previous employer? Yeah, no, I didn't either until I came here. But it's really pretty easy to use and to understand, and just know that we do it this way so that we can afford a really good overall plan for you and keep the costs low for us while keeping your out-of-pocket low or non-existent, because this is really amazing. So when you work with Anthem, you'll have to find a primary care physician because we're an HMO, a health maintenance organization. And in the HMO, you find a PCP, and that one person directs all of your other care to everyone that's in network. The good news is we are in one of the largest networks in Southern California, the Blue Cross HMO California Care, large group for traditional HMO network. So you'll have this information on how you can find a PCP, and when you enroll to be effective October 1st, you'll have to designate a primary care physician unless you want Anthem to choose one for you. Also, one thing to look at as you're getting ready to actually enroll in your benefits or sign up for your benefits is your prescriptions. Remember, I told you that you're going to pay out of pocket for prescriptions according to that, that plan of 10, 20, 30, 30, or 20%. So you have to check what's called a formulary. And you can search it. There's more information. You can click through on this and search to see if you take any medicines on a regular basis, where they are in the formulary, and then you would know how much they cost, $10, $20, $30, or if they fall into that group where you have to pay 20%. Other great things with Anthem is you can create an account there, and I really strongly encourage you to do that. In addition to getting explanation of benefits, which you'll need for reimbursements, and which we'll talk about, you can view all of your benefits. You can print a temporary ID card. You can get your claim information. They have discounts, wellness tips. You can find the providers. All of that is really, really great with the Anthem website. And there's a lot of other Anthem extras. So they have Live Health Online, 24/7 access to medical care, nurses. The mail-in prescriptions where you can get 90 days for the cost of 60 days or 3 months for the cost of 2 months. The EAP, the resource advisor, will prep. If you want to make a will, it's free. It's online. You can do that. There's a mobile app, and there's also travel assistance. So you want to make sure that you do sign up for that account after you are eligible and enroll in benefits. And then finally, another perk that Anthem has is if you travel out of state for over 90 days, and this is maybe relevant now more than ever, as people have to leave and go places to be with family or take care of family. If you're going to be away for 90 consecutive days or more, there's a guest membership in another HMO so that you would still have healthcare coverage. So with Anthem and the difference card, again, Anthem is the medical carrier. They provide the medical plan. You go to Anthem providers within that network. Anthem providers submit the claims to Anthem, and then Anthem will provide you with these things called EOBs, or explanation of benefits, after each service. It's not a bill, but it's a breakdown of what you had done and the medical codes that are associated with that. So with the difference card, then you're automatically enrolled, as I said. It works in conjunction with the Anthem plan designed to save you and us money. You will receive a difference card MasterCard in mail at your home. Please always check your mail. It comes in a plain envelope. Don't throw it away. It's a MasterCard. And through the difference card, you swipe it and we pay that $40 primary care physician, PCP, and specialist copay. It's just like any other credit card. You swipe it for $40. And then through the difference card, you're going to get reimbursed for all or part of the medical coinsurance and deductibles, except your portion of those charges. So for example, that $250 for the hospital visit. So you're responsible for using difference card reimbursement then to pay for any Anthem bills directly. So what you do is you submit the Anthem EOBs for reimbursement as soon as you get them. Usually you will get them, they'll be online before you actually get the bill from Anthem. You'll submit them for reimbursement to difference card. They'll give you the money, and then when the bill comes in, you'll have the money to pay. So let's talk about what that looks like. All right. So you go to the facility. You're going to give your Anthem ID card to the doctor, the urgent care, the hospital, whatever it is. You're going to get your services. And then wherever you went, they're going to process a claim with Anthem. They're going to submit the bill for all of their charges. And when you go to the doctor, sometimes it's just your doctor's time. Sometimes you get lab work. You know, if you go to the hospital, you may have a doctor, you may have lab work, you may have anesthesiologists, you know, all of these different people involved with whatever services you got submit their claims. And then you get that EOB, that explanation of benefits. I will say, it says Anthem will mail this to you, or you can obtain it from the website. Most people get it from the website because I haven't really seen Anthem mail it. So it's one thing we're trying to figure out, because as I've been doing this presentation while Linda's been out, I thought, I've never gotten one mailed to me. I've had to go to the website. So my advice to you, sign up, go to the website. And then as soon as you have that EOB after your visit, it will show you, like I said, it'll tell you all of the services that you had, any lab work that you had, what the medical code is and what the cost is. And then you're going to submit it to difference card along with the reimbursement form. You can email it, fax it, mail it, or use a mobile app where you take the photo and it uploads. It's really super simple, and they're going to process it. The only time you ever need to do anything different is if it's a hospital bill for $500 or more, then you need to submit that hospital invoice as well. So difference card then gives you the money that you're going to owe. And you owe it. The difference card can't pay it because the service happened to you, not to the difference card. That's a company. So while I'm saying that you owe the money, we have the mechanism in place that we give you the money through the difference card. So you're not out of pocket. So it's a little bit more work, but the cost savings for you and for the agency is tremendous. And so if you have any questions about how to do this, please, please, please contact Judy or contact Linda, and we'll have contact information on the very last slide. And again, you'll have this so you don't have to fish around for any of the contact information. Please ask us. Please do not just pay your bills from Anthem and suffer in silence. We do not want that to happen. We want, through the difference card, to give you the money to do that. But legally, we have to use the difference card to do it. So again, you're responsible for paying anything that Anthem bills you, and you'll get the reimbursement from the difference card, per what we noted previously, those columns. The difference card can only be swiped for the medical copays, but providers should not be asking you for money up front. Not at all. The only thing that they should be asking you for is your copay, and that's what you swipe with your difference card. So please do not worry that you're going to have to pay a lot of money up front. You absolutely will not. I know this is true. We had a situation just last week where we had someone who was undergoing outpatient surgery, and their provider was asking her for a couple $1,000s up front. And she reached out to the difference card. They reached out to us. We reached out to Anthem. Anthem reached out to the provider and told them, no, you cannot do that. And then voila, it was solved. It was just a provider that thought that they could do that. Nope, can't. You can't pay that out of pocket. The only thing you should be paying is the copay, and that doesn't come out of your pocket. That's with the difference card. So if you have questions on this, if someone tries to ask you for more money, on the back of your difference card, MasterCard, there's a phone number to call. and you can call Difference Card and then we'll talk to that provider that will walk you through anything that you need to do. We have a lot of ways for you to have customer service around benefits, and we want you to know all of the ways that you can take advantage of. So when you have the EOB, and again, you'll get that before you get the bill, go ahead, one of these ways, email it, fax it, mail it, use the mobile app, send it to Difference Card along with your reimbursement form, and they will send you that money back. So sometimes reimbursement means you get it after the fact. Here for us, reimbursement means you can have the money in hand when you get the bill in. So that's really nice. Go online. So you're going to go online, you're going to create an Anthem account, but also create a Difference Card account. Because in there, this is where you can upload things. You can set up direct deposit. So you can get that reimbursement right into your checking or savings account, which is really great. The reimbursements usually come in, they say 4 to 12 days. But if you have Difference Card direct deposit, I have it set up, I can get reimbursement in 1 or 2 days. It's that fast. It's really wonderful. So then that way I don't have to, look for extra money when I have to pay a bill. There's also live chat, and that's kind of cool. You can get it on your mobile device, and there's the instructions for that. As I mentioned, you can get direct deposit, and when you create your account, you can log in and find out how to do direct deposit. And just some reminders about the Difference Card. This is all about in-network providers, because again, we have that really large medical network, but we have to stay in network with an HMO. Our network is so big, it's the largest, one of the largest, if not the largest in Southern California. It includes those big healthcare systems like UCLA, Cedars-Sinai, the Providence hospitals and doctors, healthcare IPA. So it includes all of the large medical groups as well as smaller doctors and physicians. So it's a big network, but you have to stay in network. If you want a sticker to go on your MasterCard, your Difference Card MasterCard, to clarify what you need to pay, just ask HR. You can only swipe it, here's a tip, you can only swipe it for one copay at a time. So like if you have a child on your plan, if you both go to the doctor the same day, you can't just swipe it for $80. You have to swipe one $40 copay for you, one $40 copay for your child. And then because this is a legal arrangement, this healthcare reimbursement account, keep your receipts because they get audited and they need to ask for receipts sometimes. I have found this usually happens on glasses. I see a couple of y'all wearing glasses like I am. So generally when when I go to the ophthalmologist, I use nope, that's not it. That's my FSA. Strike it. If you're watching this in a future iteration, ignore this part here. I'm going to talk about that in a second. But they audit your copays to make sure that you went to the doctor at that time. So it was my pulmonary specialist, and they audited, and I had to give them the copy of my my receipt that I got there. So when I go to the doctor and I swipe it for my copay, I always ask for a receipt. The only time your claim will be denied is if the services were denied by Anthem. So if you went out of network, if you got the services somewhere else. If it's a duplicate claim, if you forget that you already submitted and you submit it again, they'll deny the second one because they've already paid you back. If you have a dependent who's not enrolled with the Difference Card, because sometimes that happens. They're not actually on our insurance, but you're trying to get reimbursement because you forget. Or a complete EOB wasn't submitted, maybe you missed a page when you were scanning it. Or the EOB indicated you didn't know anything. So if you don't owe anything, there's no reimbursement to give you. So those are some of the most common reasons why something will be denied. So because we've got Anthem and Difference Card, it can get a little confusing about who you talk to when. You contact Anthem about benefits and services, bills. Why did Anthem deny the claim? Those sorts of things. Or you lost your ID card and you need a new one. Remember, with your Anthem account, you can print a temporary one, but you want the hard copy. So if you lose your hard copy ID, call Anthem and get a new medical ID. You contact Difference Card to ask, how much should I swipe for? Why didn't it work? You know, sometimes like any credit card, it might get a little fritzy. You have to wipe off the back, might need a new one. How much will the Difference Card reimburse me on these things? When will I receive my reimbursement? Why did I get denied? Anything having to do with the Difference Card, you ask Difference Card. Anything having to do with the medical service, you ask Anthem. So before we go on to the other insurances, any questions about that? I know it's a lot of information to cram into a short amount of time, and that's part of the reason we give you the presentation. But again, you've got, at the end of this, you'll see all the different ways that you can ask for help with any questions. Okay, I'm gonna keep moving along. All right. With our dental plans, you actually get a choice. You don't have a choice of medical plans. You have one medical plan. But with dental plans, you have a choice of two. A dental HMO, so it works like the medical HMO. You have to find a primary care dentist. And then a dental PPO, or preferred provider plan. And that works a little different. So with the Anthem PPO, you can go to an in-network dentist, and it's a large dental network. So chances are your dentist, if you have a dentist, might be in that already. But with the PPO, you can actually go out of network and you'll still get reimbursed for some portion of your cost. So in network, you can see, I'm sorry, in the HMO, you can see 0 office visit copay, 0 you out of pocket for cleaning, 0 for x-rays, $30, 1 surface filling, blah, 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 blah. And the great thing about the dental HMO, there is a summary plan description that lists out all the benefits that you could have and how much it will cost you. So it will tell you exactly, you know, how much it costs for 4 crowns, whether they're metal or whether they're composite or porcelain or something like that. You can see we've also got an orthodontia for adults and children benefit too. So if your children need orthodontia, or if you need orthodontia, that's your plan maybe. If you need it, definitely, because the PPO only has orthodontia for children, and they'll only reimburse you for $2,000 max. It's a little bit better here, but you can see it costs less here. So with the Anthem PPO, if you go in network, if your dentist is in network, you have a $25 deductible, which you have to pay before any other services. It's waived for any diagnostic or preventative services like your annual checkup. It's waived for that. And this is individual family. The maximum benefit is $2,000 per person. So if you need a lot of dental care, you might want to go with the HMO because it's unlimited benefit maximum in the plan year. Here, the most that they're going to pay for is $2,000 worth of care. Preventative services are covered at 100%, meaning you don't pay anything out of pocket. Basic services, simple things, x-rays, cleaning, x-rays, basic fillings covered at 90%, meaning you'll pay 10% of that cost in network. Major services covered at 60%, meaning you'll pay 40% of that cost in network. And for the children, orthodontia is covered only at 50% up to $2,000. And if you go out of network, if your dentist is not in the PPO network, that's okay. You're going to pay a little bit more, $50 of a deductible. 100% preventive services, you're still not paying anything. Basic services, you're going to pay 20% for those. Major services, root canals, complex dental work, you'll pay 50% of those. You're paying more, but you have choice. So that's the difference between the two plans. You're going to pay less here on the HMO because your choice is limited. You're going to pay more here for the PPO because you have more choice. You can go to any dentist, but for that, you're going to pay a little bit more out of pocket. So it's up to you which one is right for you. You have to do a little bit of research and figure out if you have a dentist you like, are they in the plan? Are they in the HMO plan? Are they in the PPO plan? You know, and you can start narrowing it down from there. If you have that HMO, you also have to find your primary care dentist, and here are some instructions on how to do that. And with vision, we go out of Anthem now. So now we're with Guardian VSP Vision. Great vision plan. It's a very big vision plan. Most of your independent ophthalmologists are with VSP or optometrists are with VSP. Some of the networks, the chains like LensCrafters are also with VSP. And you have to be in network though, so you have to find a VSP care provider in network. When you do that, you only pay $10 for an exam, $10 for materials. So like if you have glasses or contacts, there's materials, you pay $10 for that. Lenses for your glasses are covered 100% after that $10 material copay once every 12 months. The frames, that's where they get you, right? The frames, they will pay 80% of any amount over $120, and then you'll pay 20% of that remaining amount. Contact lenses, if they're medically necessary, you don't pay anything because they're covered at 100%. If they're elective, you'll pay any amount over $120. There are discounts with VSP, so always ask for a discount when you go. You say, do you have any VSP discounts? They'll usually tell you, but ask. And you can see with the lenses and the contact lenses, you can get new ones every year. With the frames, they only pay for the benefit every 2 years. And for VSP, you can go online and you can find a VSP provider within their network. Any questions about dental or vision before we keep going? Good group, you guys are getting everything. All right, so now we have some additional insurances. You are covered, no cost to you, through the agency for life and that AD&D. What does that mean? Accidental death and dismemberment. So life insurance benefit really isn't for you, is it? You're going to be dead. I mean, let's face it, that's why life insurance is triggered. It's going to go to your beneficiary. But AD&D is for you because it covers a catastrophic event, like if you become paralyzed, if you lose sight or speech or hearing, if you lose a limb. It is really important because then you're going to get paid out an amount to help you with your living expenses. And if you, hopefully not, but if you would happen to pass away while at the agency, there is also a death benefit with AD&D. That's the second D. Nope, that's the first D, death. And then the second one is dismemberment. Doesn't have to be dismemberment. I don't know why they don't call it something else. That's why they call it AD&D, because it's more than dismemberment. But the important thing to remember is you are covered in our group life and AD&D policy, $25,000, and you don't have to do anything. Evidence of insurability, that just means you have to fill out medical questions. Nope, not for this. Now, if you wanted to buy some life insurance, you can do that. You absolutely can do that. And if you want to, you can add your spouse and children on there. And with this, you can get 5 times your salary, up to $500,000 max. Your spouse can get up to half of what your employee amount is. And children, 10,000 max. That's the most they'll insure. You have a guarantee issue, meaning that you do not have to fill out any medical questions, of up to 100,000 for yourself, 10,000 for spouse or children when you sign up, when you're first eligible, when you're a new hire. So that means that if you've been denied a life insurance policy previously because of a medical condition, sign up now. They will not ask you questions of up to $100,000 of life insurance, or if your spouse has. So take advantage of this new hire enrollment period to do this. If you decide that you want to purchase voluntary life insurance where you're paying for it later, you will have to fill out that medical questionnaire. So we also have then disability insurance. So disability insurance is paid by you, just like that voluntary life. You can get a benefit of up to 60% of your monthly salary, up to a max of $5,000. But long-term disability is really long-term. It doesn't start until almost a year after you become disabled. And it lasts through Social Security normal retirement age. There is a pre-existing condition exclusion. And so in the documents that you'll get, you'll see all of this, where to go to read the fine print. We won't read the fine print here, it's way too much. But it's important to know that a lot of these plans have exclusions, and you need to look and see if there's a pre-existing condition exclusion. So voluntary life insurance, voluntary long-term disability paid by you. Also short-term disability, if you'd like to get that, is paid by you. Now, we're all covered in the state of California under the California short-term disability insurance or state disability insurance. It's that line on your paycheck that says CASDI, and a little bit of an amount comes out each paycheck. You're paying into the state disability insurance fund. And then if you're disabled for more than 7 days, but up to 52 weeks, state EDD, Employment Development Department, will pay you back up to about 60% of your salary. You have to file forms with the state. It's not anything that the agency does, because this is your money going into the fund. You then have to get it if you're disabled for that short period of time, under 52 weeks, under a year. Hey, long-term insurance starts at a year. So short-term disability is less than a year. So you can decide if you want that. You can choose a weekly benefit. If you want it, 60% won't get you to full salary. So if you want something to help bridge that gap, you can purchase short-term disability insurance. There's 2 plans, a 13-week plan and a 26-week plan. Those are the only 2 plans that we offer. We don't offer a 52-week plan, but again, the state disability is there for 52 weeks. And it's based on your age and which option you want. So take a look at that if you're interested in short-term disability. We also have a voluntary accident insurance. With voluntary accident insurance, there's no evidence of insurability. An accident can happen to anyone. Doesn't depend on a medical condition. And they pay you a lump sum tax-free benefit based on the type of injury you sustain. Is it broken bones? Is it a cut? Did you injure your eye? Did you rupture a disc? That kind of thing. There's also 2 levels of plan here, Advantage and Premier. You can see Premier is a richer benefit plan, so it's going to cost more per pay period. These are monthly premiums, and then per pay period cost would be more too. So, but you can add in your spouse, your child, your full family. We also have voluntary critical illness insurance, and this covers these conditions here: heart attack, blindness, major organ failure, kidney failure, brain tumor, coronary artery bypass surgery, and there's stroke and cancer. So this insurance, if you buy it, it only covers these types of critical illness. And then you can use it more than once, if hopefully not, but if something catastrophic happens twice during your time, you can use it each time. And it pays you a lump sum at the diagnosis, and then it will pay out certain milestones. And then finally, we also have hospital indemnity insurance that you could purchase. So this is, if you have to go into the hospital, it will pay you $1,000 for each covered hospital admission. Remember, if you are admitted to a hospital, you owe $250 of whatever cost the hospital is. Do hospital visits cost more than $250? Heck yeah, but you only have to pay $250. If you purchase hospital indemnity, they will pay you $1,000. You have to buy it, obviously, and you can see it's a little bit more expensive. You can add your child, your spouse, et cetera in, but it could complement, it could help you get money in your pocket at a time when you might need it. Any questions about those? Again, there's details in what we're going to send you. We're just giving you a quick overview of the types of insurance that are available to you. All right, we're moving right along. Want to share about the Employee Assistance Program through Resource Advisor, through Anthem. It is 100% paid for by the agency. You don't have to pay for anything. And it is a free, confidential 24/7 service where you can get help with things like stress or anxiety, if you're having problems with your children, substance abuse issues, relationship issues. And then the services can be for yourself or any member of your household. You can get up to 3 in-person sessions, probably telehealth right now, with the counselor per year, per individual. You have unlimited access, and it's confidential. We don't ever know who uses it. It just wraps into the Anthem bill. It's not coming out separately. We don't ever see names. So we talk about the EAP a lot here because the work that we do is really stressful. And we have things that happen where people need to talk to other folks. And so if you're not connected regularly with a therapist or a mental health professional. Going through EAP can help set you up with someone and also give you someone to talk to while you're getting your Anthem therapist set up. So it's really, really wonderful. They will also help with financial issues. If you need like referrals to legal, like an attorney, to a financial planner, if you need help with elder care, child care, they're a very, very good resource. Flexible spending accounts. So flexible spending accounts are pretty important because they allow you to put aside pre-tax dollars for things that you would usually pay for anyway. It gets a little confusing for us because the difference card, remember that from medical? Difference card is our provider for the FSAs, the flexible spending accounts. We figure it out. It's a little confusing, but you'll understand it. With a healthcare FSA, it allows you to use pre-tax dollars for qualified healthcare expenses. Well, what could those be? Well, it could be the cost of your glasses or your contact lenses over what the plan pays, the cost of your dental work over what the plan pays, your prescription costs, because remember those are out of pocket for you. And then also some over-the-counter things like saline solution, not allergy medicine yet, saline solution, Band-Aids, first aid kits. All of those are covered expenses under a healthcare FSA. You can contribute up to $2,700 in a plan year. Now for you, it's going to be very short because you only have 1 month. You might not want to contribute $2,700 for the healthcare FSA in 1 month because that would be, you know, close to $1,500 coming out of each of your paychecks in October. You may decide that I'm not going to sign up for October since my plan year is only a plan month, but you may want to look at this for next plan year. So think about your medical costs that you're going to be paying. You can roll over $500 to the next plan year. You have up to 3 months from the end of your plan year to submit any claims. So take a look at this. The other way to use an FSA is with dependent care. So child care costs for a dependent child under the age of 13, babysitters, nursery schools, preschool, daycare centers, or if you have a member of your household who's physically or mentally incapable of caring for themselves, and they qualify as your federal tax dependent. Could be a parent, could be a sibling. For this, you can contribute up to $5,000 per plan year. Again, might not want to do it for October because that would be $2,500 coming out of each paycheck. You have 3 months. You can't roll over this money. The IRS doesn't allow it. It's not us. I'm sorry about that. And we have a 403B retirement plan through Voya. So in 2020, this is a calendar year because retirement plans are covered under a calendar year. You can set aside pre-tax dollars to save up to $19,500 in this calendar year for your retirement. Or if you're 50 years or older, you can contribute $26,000 in the calendar year. Generally, these amounts go up every year. The IRS sets these amounts that you can contribute. You can enroll at any time during your employment. This is one benefit. You can enroll at any time. Doesn't matter. You can change your contributions during the plan year. You only have access to the funds that you contribute. Unfortunately, at this time, we do not have an agency match. And the plan is administered through Voya. Another benefit that you have is what we call Benefit Hub. And on Benefit Hub, which you would go here and use our referral code, you can get discounts. This is where you have also access to the benefit plan summaries and the summaries of benefits and coverages, all the detail, all that legalese, and more. So the discounts, you can get discounts on things to do once we can do things anymore, travel once we can travel, but things that you can buy, places you go to eat and those sorts of things. It's really a neat place. Go and see it. How much do things cost? Well, here are your rates per pay period. You can see for employee only, medical, dental, regardless of whether you take the HMO or the PPO, and vision, you pay nothing per pay period. If you add in a spouse or child or family to any of these coverages, you will be paying something though. When you enroll online, the dependent and the voluntary, the hospital, the accident, the critical illness, the voluntary life, short-term disability, long-term disability, all of that will calculate on Paycom. and you'll be able to see what the cost will be coming out of each paycheck. So if you go, can I afford critical illness, accident, hospital, short-term and long-term disability? And then you see what it would cost, you go, no, maybe I am not going to get these two or this one or what have you. So it's really neat to be able to see how much it's going to come out of your paycheck. And when you enroll, if you need some help enrolling, or if you want a one-to-one person to explain your benefits to you, we have benefit enrollment counselors through a company called Voluntary Benefit Advisors. So they'll be able to help you with enrolling and also talk to you about the benefits that we have. So what do you need to do now? Well, start reviewing all the benefits materials. Decide whether you're going to use VBA to enroll or enroll yourself in Paycom. Find your medical and dental primary care physicians if you're having the dental HMO. If you're going to enroll dependents, you must have their date of birth and social security number available. You have to have that to enroll them. Get those PCP numbers. And then watch out for emails from the benefits team. It's going to be Judy sending you emails that you need to either enroll or decline your benefits. So you'll get your first run around the 6th of September. Yep, that's a Sunday, so it'll probably be the 7th of September. Oh, that's a holiday. Maybe we'll do it on the 4th. I'll talk to Judy about that so that you don't get shorted. Around the 4th of September, the 13th and the 20th of the month, because you have to enroll or decline by the 20th of each month prior to your eligibility date. So for you all, that means you have a little under a month to enroll or decline your benefits. Here's where you can write down your eligibility date, which is, everyone shout out, October 1st, right? And what do you need to do for VBA? All you're going to need to do to work with them is give them a phone number. You're going to set a time and date, and they'll call you on that phone number. But have all that stuff with you because you still need your dependent information. You still need your PCP information. So again, really important. You have to enroll by the 20th of the month prior to your eligibility date. I can't say this enough. You have to enroll by the 20th of September. Here's our contact information. The three things that you're going to use most of all: benefits at the people concerned, or you can call and ask for benefits. It'll go to Judy or Linda. Difference card, because you're going to have difference card questions. And then this thing in the middle we didn't talk about, My Benefits Champion. And that is through our insurance broker. They're kind of like your go-to if you don't know where to go. They can help you with everything. Don't know what to do with your EOB, you have questions, you need help with the claim, you need to find a doctor, can't figure out the Anthem website, you need to find a doctor. My Benefits Champion is there for you, and they will get back to you. And then we give you also all of this contact information. You have our group number, because sometimes they'll ask for group numbers, the name, sometimes it's our group number, the website, any phone numbers that you need to call. Here's that information about Benefit Hub again. So that's the end of the presentation. We are almost at 10 o'clock. I would like to do the raffle, and we can probably